The lack of coordination that does exist at the federal level. I know everyone's trying their best to do what they can now after the disaster. I do see this truly as a national disaster, not just a regional or local disaster for a variety of reasons, but I appreciate all the work that you folks are doing. I'd just like to focus a little bit again on sort of the post-disaster response. NIOSH and OSHA are working together. You said, Dr. Howard, is that correct, to develop an interim guidance? Is that what it's called? An interim guidance? Can you talk about that a little bit?
Both OSHA and NIOSH have been looking at all of the hazard profile in all of the exposure groups of workers involved with the response, and have been developing a comprehensive interim guidance for protecting workers and volunteers in the Deepwater Horizon response.
Can you give us some specifics as to what that is, what that means, what are the different things that you're looking at?
Well, there's a number of very important issues. Dr. Michaels mentioned the issue of heat stress. Fatigue, long hours, is another important issue. The issue of personal protective clothing is an important issue. Clothing can exacerbate heat stress. The issue of respiratory protection is an important issue. So all of those issues we're trying to put together into a guidance that both agencies can stand behind, would be able to inform the Coast Guard, BP, all of the contractors and others involved in the response.
And what about psychological and mental stress?
Clearly that is, would be in our guidance too. It's, first of all, long hours and fatigue add to stress, and the work itself can be very stressful. Response work itself can be stressful.
When might we have data? I assume you're collecting some kind of data at this point as far as the effects, not only of the dispersants, but the oil and the fires, all the rest. When will we have data that we can?
You know, we're not yet focused directly on the effects. Right now we're focusing on prevention, and so we have tremendous amount of data about the exposures, and that's we are focusing on. In addition, though, every report of a potential work-related illness is followed up on by the medical detectives at NIOSH. Yesterday, the Institute of Medicine convened a large meeting in New Orleans that both Dr. Howard and I participated in to think about how to collect data on effects into the future, both physiologic and psychological effects. And that process is just beginning. Hopefully, to this point, there aren't too many effects other than mental health related. We believe that the physical effects, we know a great deal about what's going on right now, and fortunately, they're still limited. But we need to follow up on that.
Do we know how many workers have reported illnesses that may have resulted from the cleanup work? Do we have specific numbers on that?
Dr. Michaels mentioned several hundred workers have reported symptoms. I believe that was one of the issues. A lot of workers report symptoms of odors, hydrocarbon odors. A lot of workers report heat-related illnesses and have sought medical attention. The department has a mobile medical unit in Venice, Louisiana, and we've had over 178 visits to that, both from workers as well as residents in the area.
And I guess sort of going back to the whistleblower issue, but something broader than that, that is workers feeling free to report when they're injured or when they're suffering illnesses. How are we doing on that post-disaster at this point?
That's a very important issue. We've gotten one formal whistleblower complaint so far, which we are following up on. We've made very clear to the public, to workers, and to BP that workers should feel free to call us. BP has said workers are free to call, but I think this is a message that we have to repeat over and over because we aren't everywhere all the time, and I think people already are feeling very stressed and very concerned about their future, their employment, their income, their families, and I think this is an issue we will have to deal with as long as the cleanup goes on, and we have to play a proactive role in encouraging people to call us.
And making sure that they're free and that they won't be prosecuted in some sort, or they won't be fired, or whatever the case may be.
And if we find an example of that, to make a public shaming of the company involved. We have had examples so far where subcontractors have done things that are clearly against our regulations. For example, charging workers for protective equipment, which should be free. And together with BP, we've made very clear that company that's wrong. Those companies have publicly said we were wrong, reimbursed the workers, and done it in a way that they won't do it again. And so we have to be on the case on this, because this is a real concern.
Thank you. Thank you all, and thank you, Mr. Chair.
Thank you. We currently have votes on the floor. My intent is, before we go to the vote, to